Core behavioral health was the amalgamation of a number of the community mental health organizations, which occurred because of changes in funding through the Hamilton County Mental Health Board. Our mission was to provide services to adult severely mentally disabled, and we offered those services throughout Hamilton County. The challenges that we were having as CORE was that a lot of our backroom operations, our accounting particularly, was deficient because we didn't have the resources to pay for the accounting we needed. As the reimbursement methodology became more and more complex, we knew that we were continuously falling behind. So as we talked about what our options were, affiliating with a larger, better backroom organization was really where we concluded. Talbert already had those departments available, and for what we ultimately negotiated for a cheaper price than what we were providing and a much higher skill level. There was significant apprehension on behalf of the board as far as an affiliation with what we finally referred to in Hamilton County as the 800-pound gorilla, which would be Talbert House. And the way we approached it was we entered into a services agreement with Talbert House, where they were to provide services, the backroom services that we talked about, and there were pretty tight parameters on the provision of those, and we as an organization had the right to opt out if those services were not satisfactory. We agreed to have Talbert House hire all of our then employees so that the HR functions, the payroll functions, were all handled by Talbert House, and we effectively, under the service agreement, reimbursed Talbert House for those services. Major challenges were integration of our staff because they were being placed in a different environment, there were different benefits. Apprehension of our board, losing our autonomy, being concerned about whether we would be able to continue to perform our mission, which was to provide services to the severely mentally disabled. We had lots of discussion with staff, trying to explain that they were going to be better off, because one of the issues that was becoming obvious in the mental health world was that we were seeing smaller organizations die and go away. And what we wanted to do is make sure that we lasted, we were able to continue, and again, continue our mission of providing services to severely mentally disabled. The first to affiliate with Talbert House was Core Behavioral, then Children's and Family, and the third was Norson. All followed the same approach of being subsidiaries of Talbert House with services agreements to provide their back of the house. After a couple of years, when all three of the organizations were comfortable with the arrangement with Talbert House, it made sense from a duplication of services standpoint to merge the three organizations into a single organization called Centerpoint to handle all of the behavioral health work that Talbert House was doing. All three organizations, now one organization being Centerpoint, were comfortable with the relationship. And if it made sense to save money in duplication of certain positions, then let's save the money, because our goal, our key goal, was to make sure that our populations were served. And in fact, going back to the original arrangement, we wanted certain representations that Talbert, if for whatever reason we went away, would continue to serve this population, and they gave us those assurances. I would suggest that the best approach for any organization is to be nimble. The market is changing, is constantly changing. Any organization needs to be able to move in response to those challenges. When we were looking at what we were doing, we looked at the healthcare sector. What happens in healthcare happens in behavioral health. Those are examples that any organization in behavioral health can look at and say, these are probably where the trends are going to be, and maybe we need to look at those as opportunities instead of challenges and figure out how we can recreate ourselves to carry out our mission.